As well, our next speaker has music as a hobby. So in her free time, she's coaching singers. But in her regular days, she studied medicine and is now working for Philips as a senior clinical consultant PHM. And she just told me that she just didn't want to accept the status quo she had becoming a doctor, and she wanted to change something. And that's why she changed from being in surgeries, being in a consulting company. And she's here today and telling us, answering the question, how we shape future health experience. Please welcome our next guest, Henriette.
Hi everyone, welcome to my presentation that's called A Walk in the Park. You already listened to some music regarding the topic. The subtitle of that presentation is How We Shape Future Health Experiences. So you may be wondering how a 70s to 80s song will relate to how we can create a health experience of the future. That's quite easy to say. Going to the history of that song. Nick Drake wrote it, and Nick Drake is the name, and he wrote it because he broke up with his girlfriend. And he went to a park, taking a stroll, because something big ended. And when something big ended, or ends, we can be cornering in the sideways, or we can develop something new. And he developed that song. And actually it went a top 10 hit. It was the only top 10 hit for that group, actually, so maybe some more breakups should have happened for him. So it relates to a medical technology company like Philips in that way, that we have something big ending right now. There are business models of the past that do not work for the future. There's commoditization, there's a high price sensitivity in the markets, and innovation as it was before, like iterative ones, will not be paid for, will not be accepted so much. And at the sideways, there are startups coming up with fabulous ideas. So the question is, how can we compute it in the future? I think the previous speaker was a bit dystopic about big corporates managing that process. So I want to tell something about how we try to cope with it and how we have evolution of our business model over time. So we keep sustaining in the markets. Looking at Philips, it's a big corporate. It has 18 billion sales worldwide, is in about 100 markets, has 77,000 employees. That's quite big. And maybe you don't even know it for health tech, but you know it for previous accomplishments, like, for example, building light bulbs, Philips lighting and stuff. So it's not basically the thing that you would remember, say, from CDs, cassettes, whatever we have built in the past, and that we are focusing now. So what I want to say with that slide is, you can only sustain by transforming yourself essentially. And you can see that, for example, with the divest or the selling and only brand licensing of three important topics of the past, which was TV, multimedia approaches, which was entertainment, and which was also containing actually music production. And then it's Philips Lighting, which also got outsourced. So we're not sticking to previous business models, but trying to evolve. And what are we evolving to? To a health tech company. So it's about medtech, classic hardware business, creating CTs and MRIs, and also software. That's where my home is. And then on the other side, we are going for consumer electronics because as a consumer-centric company of the past, we are already experienced in sensing what customers need, want, and how it needs to be delivered. And that will always be in the context of self-care and trying to improve your life through technology. That can be something as simple as creating more healthy meals, can be something as simple as oral health care via app, via AI support with a more advanced approach. Going further with that vision, we are aiming to create a healthcare continuum that starts with a healthy living and does also include then the prevention side of medical, and then goes into a very precise diagnostics and treatment based on what we had as an offering in our past and trying to evolve further. So, and then comes the important part. Normally it stops after that in the classical business model. But what we're aiming for now is, as you can see in that line below, it's connected care and health informatics. We are trying not to leave the patients alone and the physicians alone and the nurses alone then, but to try to create an environment that's holistic and will guide the patient back from treatment over home care solutions back to healthy living, because that's where we want to go. Even when we're older, we don't want to stay that patient that is always returning to the hospital. We want to evolve and get back to the best status of living we have. And that creates a vision to have 3 billion people's lives improved by 2030. You might wonder how that is calculated. That's a very interesting thing, because it is actually calculated, and we are recalculating it each year, and it's based on the touch points we have with our solutions with customers and patients all over the world. And also for the employees in healthcare, how we can improve their experience of the care delivery. But looking at the reality, I mean, my responsibility in that company is delivery of projects. I'm in implementation, so I have a lot of things to do with contracts, with data protection, with very hierarchic systems in medicine, so it's not quite there. And from a treatment standpoint, we are at a point where we are reactive. We're not preventive in healthcare systems. We're not even value-based so much. So looking at that, we see even for the professionals living in that classic situation, or I might even say historic situation, there's resource constraints, so it's not like back in the days where everything was paid for. We have aging populations, so it might not get easier in the hospital if more chronic diseases appear due to that fact. And it creates a lot of pressure in the working space. And then we go to an enabler, which is also a challenge, and that's digitization. We're not there. Most of the things I watch in hospitals is paper. And people are telling me, or CTOs are telling me, yeah, we're digitized. And then you go to the nurses and they say, we're doing everything on paper. So where is that gap, and where can we fill it with solutions that make life easier for people? Looking at the professional space and moving towards the reality of the future. The future of healthcare is not in the classic healthcare delivery system or mode. It's there, it's at home, it's in our daily lives. You might even have a fitness tracker with you. Your phone is sensing how much steps you're taking each day. You are optimizing the way how your running goes, how your training goes, how your food is going. So everything will be corrected and affected by digitization in some ways. And even your health behavior will have or will be very impacted by such technologies. And it's even more. It's not only the digital thing, it's having convenience. It's having the experience of healthcare in terms of health, not of sickness, and having that at home with the goal of getting better and getting back to your practice, or getting back to your job and getting back to the things you used to be doing before you got sick. So if the reality of healthcare is at home or not in the classic healthcare delivery, available all the time, how do we do it? Maybe by digital, but do people want it actually? It's a good question. We ask people if they want it and how they would want to use technology to improve their lives and become their own capable healthcare managers. And 63% in our recent Future Health Index report of the people asked, not patients asked, say they would want to use a health record accessible with data on their devices to engage more. And engagement or patient engagement is essentially the key. It's not about somebody telling you you should eat less or you should move more. You need to operationalize it and get it to the patient each day so you can leverage on that. So if we want to make that possible, can we be alone in this process? Yes, to a certain extent. But then we will need some experts looking at our data, looking at the results, interpreting data that maybe AI processed has been. So if we are looking at that situation, how do we link those experts intelligently to a patient? And how do we operationalize it? That's quite easy to explain regarding the healthcare continuum, because it starts with healthy living. So it starts, for example, with preventive mode for oral healthcare. And that's where our teledentistry comes in place, where we can use the data that people assess themselves at home to give them guidance on how to move forward. Not going there when the damage is done and then going to the dentist, but way before improving your own behavior. It's also through personalized care, for example, precision medicine that uses AI data in aggregated dashboards so physicians can use what's there without going through lots of paperwork and research themselves, but have it on site when they make the decision. And also going to a digital pathology, which is leveraging AI from image as a power to support healthcare. How do we deliver it is then the question. Through digital patient platforms. We need the digital dialogue with the patient to engage him. So that's essentially how we move forward from our perspective. That change can only occur in a network. We cannot do it alone. It's a highly regulated world. Healthcare is not working that a company says we want a health continuum. But it's working by engaging stakeholders, getting them together. We do that in design thinking workshops, make them understand the challenges their patients are undergoing, or the future patients, or the people who just want a healthy living undergo, and make that a power together with analysis from data on how to change processes. And that processes build use cases that we adopt then in the software. So I might close not with a citation. I started with one. It's a walk in the park. It's a walk in towards the darkness and the rapidly changing technology work of the future. But we are moving forward to tackle that challenge because there's always a way to make things better. Thank you.
Thank you so much. And just on point, having 5 seconds left. Thank you. So it's your time now. We have 6 minutes for your questions. Yes.
Do you see differences in patients' behavior with digital healthcare in different countries? So
Yes, we do. Yes, we do.
Oh, which are they?
Yes, we do. For example, the Future Health Index tells us that survey is not for Germany, it's worldwide. It's also asking Chinese people how they will adopt solutions. And we see funny things, like, for example, you would expect Europeans to be extremely data sensitive. They're not so much. They are, and they're above average in terms of the rest of the world, but they're still much less than I would have expected. I think the rate of people thinking data protection would be a huge issue was 30% or so in the last survey, so I would have expected it to be far more. So that's different in behavior, and it's a different attitude towards adopting technology, for example, in healthcare professionals. German professionals, for example, are extremely going towards a perspective of what does it bring me? Does it really ease my work? It's not like I see that as a future potential and I really need to adopt this and let's see how it goes. It's more like, okay, we have loads and loads of things to do. I have no incentive to tell me why I should do it anyways. So that's, for example, a difference. There's a much higher adoption rate, for example, in the US and even in Asia for that. Yeah. So there's a lot of differences in regard to that topic.
Thank you. Any more questions?
Well, sorry, I didn't catch the beginning, but is your goal to deliver something like an app everybody can use, where I can see myself as from the perspective of health, or what is exactly what I'm currently as a healthy person seeing from your project, maybe in the near future or already?
Okay, what you can see is two kinds of things. Like, as I said in the beginning, the division of consumer care products that are more related to the mass market product approach of the past. So that's a thing that is evolution over time. That is, for example, teledentistry. That's, for example, an app regarding healthcare. That's something that's available. But we are not producing, for example, in Germany, like a full set of healthcare data apps, like, for example, the health insurances do, or the payers in our system. But we move towards a partnering mode in which we talk to the health insurances on one hand, and on the providers, or care delivery experts on the other, bringing them together, securing a funding, and then you will get an app out of that in which you can manage your health. It's mostly regarding certain diseases, for example, that have a high economical or social impact, for example, diabetes. And then we will create a care path, and in that care path you can move. But what is more, that apps will also allow you, for example, to do generic consulting with your doctor and do generic consulting with your hospital of the future. So that's how we approach this.
Thank you.
Are you taking empathy as a method within your research? Because as a patient, when I'm not feeling so well, I think maybe that is also a big, generates a big impact.
Yeah, I would like to comment on that for the impact on our research and our daily practice. Because empathy is in the research in such terms that we ask patients how they want to be treated, only digital, what's the preferred mode, and it's actually that patients prefer a one-to-one person mode in our surveys. They say the best way I can be treated is when a person gives me empathy and I can move forward from that point. And then the other thing, empathy in our daily practice. I had that in the slide before. We use design thinking methods, so we put the empathy in the creation mode for our business models. So we can, or for example, our healthcare apps, that we can have the patient and the ones who are suffering from the actual mode today, which could be professionals as well, telling their story and reacting to that. Because that way you cannot push it aside and only follow your incentive, but you're in the same room and need to explain why you're doing certain things that way or the other, and explain yourself to the ones who will have to cope with the consequences of your behavior. So that's quite interesting, and that's what I love doing.
Probably last question. I learned that you do music.
Yes.
Very good. How much part of your, your research is to do with sound as a thing that can affect people and stimulate them or not stimulate them in terms of getting healthier?
That's an interesting question. I can relate from a Philips perspective to that in terms of our models for example, intensive care. That is highly intense on designing sound and light experiences for patients who suffer from severe disease and are in a sort of coma or intense treatment phase. So how they can, for example, profit from less sound, from noise cancelling and stuff. That's something that we do on a research base. And on the other hand, sound is also voice, is also speaking. So I said that it would be important to link healthcare experts to patients. And that's not only via app, that's
Thank you
also
very
via
much.
calling them.
Thank you for all the questions you had. Yeah, you can just
Thanks.
go on talking later on. Thank you, Henriette, for your talk. We have a little present for you as well. And just for the rest, it was our last speaker for today. Some more to come tomorrow. And just stay tuned. There will be some awards. Just be right here outside on the stage. Thank you.